Kwe Tanse Unusakut, good afternoon, bon après-midi. I would first like to acknowledge that we are here on the traditional territory of the Algonquin people. I am joined here today with Chief Medical Officer of Indigenous Services Canada, Tom Wong, and my Associate Deputy Minister, Valerie Gideon, for detailed questions at the end of my words. We continue to see increases in COVID-19 cases across Canada, and today we're here to talk about the evolving situations, in particular in Alberta and Saskatchewan among Indigenous peoples. En date du 19 novembre, il y a 1174 cas actifs de COVID-19 dans les communautés des Premières Nations, dans les réserves, pour un total de 2853 cas confirmés à travers le Canada et, malheureusement, tragiquement, 25 décès. Nous restons vigilants et continuerons à prendre des mesures alors que cette deuxième vague continue de se développer. Nous accorderons toujours la priorité à la santé et à la sécurité des Premières Nations, des Inuit et des Métis au Canada. For reference, we are currently looking at numbers that are close to 4 times the number of Indigenous people infected by COVID-19 during the first wave. This is serious. In light of the alarming rise in COVID-19 cases in Alberta and Saskatchewan, hearing from Indigenous leadership in Alberta and Saskatchewan has been critical in understanding what support is required to make an immediate and meaningful difference for Indigenous peoples in Alberta and Saskatchewan. In Alberta, there are currently 318 active cases, and there's been a total of 859 cases of COVID-19 in First Nations communities. In Saskatchewan, there are currently 344 active cases for a total of 728 cases of COVID-19 in First Nations communities on reserve. Our data is limited, and so this only represents cases on reserve. True cases among First Nations individuals in both these provinces is much higher. And indeed, if the numbers that we are seeing in Manitoba, off reserve, in urban areas predominantly, particularly as regards the disproportionate number of hospitalization and members of First Nations in ICUs, this is alarming, as if they are the same in Alberta and Saskatchewan, the scale of Indigenous infections in those areas is indeed much higher. To support Indigenous communities and organizations in their efforts to respond to the course of the virus and to address increasingly acute needs, today we are allocating $120.3 million in immediate funding to support Indigenous communities and organizations in Alberta and Saskatchewan in their response to the recent spike in cases. Over the last week, I've been in contact regularly with First Nations leadership in those provinces, and they've been specific about what is required to protect their members and communities. The measures we're announcing today are in direct response to their requests. Listening to what people need has been a key part of the COVID-19 response of the Government of Canada to date, and will continue to inform the way forward. As of November 10, the Government of Canada has committed close to $2.5 billion to support First Nations, Inuit, and Métis communities and organizations during COVID-19. This funding has been responsive to the needs raised by leadership, and we will continue to be flexible in our response as the needs evolve. In Saskatchewan, we're working directly with leadership, for example, from Hatchet Lake Dene Nation, from the Battlefords area of central Saskatchewan and northern Saskatchewan, and Meadow Lake Tribal Council, as well as provincial partners to support their efforts. Today's investment will respond to COVID-19 in 2 key areas: surge capacity and infrastructure needs. Surge capacity includes, of course, funding to communities to ensure continued access to necessary food, support for elders and vulnerable community members, mental health assistance, and cultural support. Targeted funding will be used to provide immediate response to community outbreaks. We'll be providing, among other things, enhanced nursing support and infection control measures in long-term personal care homes and elder lodges, perimeter security on reserve, and addressing increasing needs in northern Saskatchewan and supporting Métis First Nation collaboration. There's also funding for non-medical personal protective equipment to comply with provincial masking requirements, and funding for urban Indigenous organizations so that they can help Indigenous residents who may live far away from home and their communities. Infrastructure funding will cover increased isolation needs, safe accommodation for health professionals, and helping, for example, Hatchet Lake keep its airport runway safe for use and able to ensure continued food supply. In Alberta, we are working directly with leadership from Siksika Nation, Blood Tribe, Alexander First Nation, Big Stone Cree Nation, Fort McKay First Nation, and Fort Chipewyan, among others, and our provincial partners to support the various priorities identified by leadership and communities. This includes deploying a team of health professionals to respond to outbreak locations as needed, measures to respond to increased opioid-related deaths resulting from the stress of COVID-19 and further public health measures, support for First Nations long-term care centres in Alberta with visitation rooms, extra staff, and greater infection control, winterized structures to support COVID-19 drive-by testing, assessment clinics, extra isolation supports to be deployed to nations with outbreaks, essential community infrastructure support resulting from increased pressure due to COVID-19 on water and sewer systems, among others. We will also be supporting urban Indigenous peoples in Alberta by engaging urban Indigenous groups in proposal-based opportunities through the Indigenous Community Support Fund and providing extra mental health supports through organizations like Boyle Street Co-op. Last week, we allocated $61.4 million in immediate funding to support First Nations in Manitoba and their response as needed to the pandemic. This funding supports public health measures such as personal protective equipment for essential workers and community, additional primary care staff such as nurses, paramedics, and community workers, and food security to support physical isolation. Funding has also been allocated to support First Nations with active cases for perimeter security, food security, and surge capacity as needed, as well as to support the adaptation of the visitation rooms, the hiring of additional staff, and the implementation of greater infection prevention control measures in the 8 on-reserve personal care homes in Manitoba. Notre gouvernement continuera à suivre de près l'évaluation de la situation, à écouter et à travailler avec les partenaires pour répondre aux défis et enjeux auxquels font face les communautés autochtones. Je souligne à nouveau le remarquable leadership qui a permis aux communautés autochtones de faire face adéquatement et rapidement au virus de la COVID-19 durant la première vague. Je suis convaincu que ce leadership continuera à avoir un impact important. Encore une fois, je vous prie tous de prendre soin de vous et de votre sécurité. La santé et la sécurité de tous les Canadiens est notre première priorité. Ensemble, nous nous en sortirons. Miigwech, Nakumik, Marcy Cho, thank you. Merci. Maintenant, impatient de prendre vos questions.
Merci. Nous allons donc prendre les questions des journalistes. Une question suivie. We will now take questions from journalists, one question and one follow-up. We will start with questions on the phone. Nous allons commencer avec les questions au téléphone. Donc, opérateur, vous pouvez y aller.
Thank you. Merci. Please press star 1 at this time if you have a question. Veuillez, s'il vous plaît, appuyer sur étoile 1 maintenant pour poser une question. The first question, la première question est de Dylan Robertson from the Winnipeg Free Press. Please go ahead. La parole est à vous.
Good afternoon to all three of you, and thanks for taking the question. We know the military has received a request for assistance from Opaskwayak Cree Nation in Manitoba. The chief told us that this is mostly about remote nursing stations who are sending people with COVID, as well as those who need to isolate, down to the PA. He said that this is not so much about space, but that this was more about the strain on medical personnel. Can you please confirm if you have the same understanding that this is more about personnel? And also, do you have any data on how many people FNID has sent to the PA and from the number of communities that you're sending people from?
Thank you, Dylan. I'll defer to Val if she has the numbers immediately available. If not, we'll have to get back to you as in respect of the nursing capacity and support personnel that's been deployed to the PA. But over the course of the last weekend, I spent a lot of time on the phone with Chief Christian Sinclair that's facing a very alarming situation. As you know, the entirety of the personal care home in Opaskwayak has been diagnosed as positive. This is scary. It is a nightmare scenario for that community, as well as a growing infection in Opaskwayak and surrounding areas. And Opaskwayak is a hub for a number of communities. And so over the course of planning last week, there's a number of discussions over the deployment of the armed forces. Currently, the reconnaissance is being concluded, and the scope and level of involvement of the armed forces is currently being finalized. I would refer you back to the chief for those for that information. But we're ready to support in any way, including the use of the armed forces as needed. The needs are multifaceted, whether it is planning for perhaps an incoming swell of people into that area, it being a hub. It is something the community is willing to step up and take ownership for, as well as keeping its people safe. So that scope of involvement of whether it's deployment of the Red Cross in certain situations, of additional FNIB personnel and military forces, as the case may be, is really one of specific logistics on the ground that we're currently working on, Dylan. Val, I don't know if you have a number.
I can add a bit of information for sure. As you know, Dylan, in Manitoba, it is a First Nations-led pandemic response coordination effort, and with rapid response teams that are collaborative with federal, provincial, and First Nation supports. There is a rapid response team that has been set up in the high school in OCN. We've also sent additional personal protective equipment shipments on November the 16th and also on November the 18th. The Canadian Forces Assessment Team, as the Minister has mentioned, has been on site. They've had 7 members on site, and 2 medical officers and a nurse and a physician are also expected shortly. So you are correct that the primary reason for drawing on military support is to increase the number of medical personnel that would be available in the community, particularly around the personal care home situation. We were very pleased to hear that the Manitoba government announced a provincial program to train personal care home non-certified workers in a partnership with Red River College. We think that will be very helpful to support the personal care homes across Manitoba, both provincially and also those that exist on reserve. In terms of FNIB, what we have also been doing is drawing on the agency contracts that we have for nursing relief services, and we were able to identify a resource to be able to support the personal care home early on when the crisis first began.
Do you have a follow-up question, Dylan?
Yeah, and just as a follow-up, I was wondering if you could walk me through what's being done with the other personal care homes. I'm not clear if this is about PPE or using the federal guidance document to, there's not national standards yet, but what exactly are you doing with the on-reserve personal care homes, the other 7 of them?
This is, and I know you're limiting your comments to Manitoba, but the situation of personal care homes in communities is of immense concern. And at the very outset, I think I was in contact with pretty much every chief with a personal care home, knowing what was happening in places like my riding in downtown Montreal, and the deaths in those homes. We knew that the elderly were incredibly vulnerable. So we reached out and ensured, first and foremost, that they are getting all the resources that they needed, Dylan. This is very much the same approach as the second wave, and we know it's hitting harder, and the elderly are the most vulnerable in that personal care setting. We know that movement between those homes is highly ill-advised, and the sort of red zone protocols that go into place once you have an infection need to be strictly administered. So we've reached out and provided, and you'll note that in last week's announcement with respect to Manitoba, there was monies dedicated directly towards those homes, but that's only part of the puzzle. Part of the puzzle is completed by ensuring that they have the staffing, that they're reaching out to us if they don't, and then providing with proper PPE and implementation of, I guess, what's called commonly the red zone protocols when there are outbreaks. Being vigilant in those homes will be key to keeping people alive, and particularly the elderly.
Merci. Next question. Prochaine question.
Thank you. The next question, la prochaine question est de Zach Vechera. Please go ahead. La parole est à vous. Et pardon, c'est du Star Phoenix, Saskatoon.
Hi there, Minister. Thank you for taking the time. I want to ask you about the situation in Fond du Lac Dennisquilin First Nation in northern Saskatchewan. It's a community of roughly 900 people, and 60 of those members have tested positive for COVID-19 in the past few weeks. Health staff there tell me they believe there could be twice as many positive cases as the ones that have been identified. I know Indigenous Services Canada has stepped in with some supports already, but I'm wondering if any further action is being contemplated on that front, or if you've received any further requests for aid from that nation.
Incredibly important question. I spoke with Chief Mercury a couple mornings ago to make sure that he was getting what he needed in his community. We have deployed funds to address a substantial concern in and around food security. As you probably have noted, there is also a challenge with the water system and getting parts in there. We've accelerated a number of the parts that were needed to be get in, and the initial projection was that it would take a week. We believe the particular part is in community now in order to get their water plant going up and running again. And I'm getting updates, I think, twice daily from my team to ensure that is done. We are told in the interim that they do have sufficient supplies of water, but that obviously is key to any response in a pandemic plan that requires hand washing. That said, we've deployed a number of shipments of PPE, and recognizing that they have a number of other needs, we've moved quite aggressively and will continue to do so in the coming days to make sure that they are properly served. They're in the difficult process right now where they don't know the outcomes of the people that they've asked to stay in isolation, so they're tracking about 200 people in the community to see if they are positive, because they have been in close or relatively close contact to the people that have been diagnosed positive. And I believe the numbers are, as you've quoted, but we are cautiously optimistic that not all of those people will be diagnosed. But part of tracking and tracing is to make sure that the people that have been in close contact stay isolated until such time as they have received a negative diagnosis.
As a follow-up, Zach?
Yes, I'm wondering if there are any protocols in place in terms of if a member of that community has to be hospitalized. It's obviously a flying community. I know there's a hospital in Stony Rapids nearby. But my understanding is that hasn't had to happen yet, and knock on wood, it won't. But what is the protocol in that situation, and does ISC have any role in helping facilitate transfer to a hospital?
It does. I think I can pass it to Val to the specific of what is happening on the ground, but there is a decision that's taken by the medical officials on the ground if and when to evacuate. And it depends very much in terms on the condition of the patient. But Val, I don't know if you want to speak more.
Yeah, that's correct. So we would be following provincial protocols in that regard. And just in link to your previous question, so we have 5 nurses and 1 paramedic in the community. There is a gene expert rapid testing machine that's available at Stony Point. They have 120 cartridges this week and more coming, and they are in discussions with the Canadian Red Cross as well to look at potential for increased isolation sites if needed and contact tracing. We've provided about $3 million to date to the community, in addition to $2 million through the Athabasca Health Authority. The Athabasca Health Authority has a very important role in supporting that particular community, and so they've been engaged in terms of the collaboration for that support.
Thank you. Prochaine question, next question.
Thank you. The next question, la prochaine question est de Marie-Laure Josselin de Espace Autochtone. Please go ahead, la parole est à vous.
Oui, bonjour. En fait, j'aimerais avoir plus d'informations sur les 120 millions. Je sais qu'ils ont été annoncés donc aujourd'hui, mais combien, est-ce qu'ils viennent d'une enveloppe qui était déjà là ou c'est quelque chose c'est de l'argent nouveau? Et est-ce que ça va vraiment être juste pour 2 provinces ou il va y avoir d'autres annonces pour d'autres provinces outre que l'Alberta et la Saskatchewan?
Merci pour la question. Effectivement, c'est des sommes qui sont nouvelles. Ce qu'on a entendu de par nos discussions, prenant acte évidemment de l'augmentation et de l'éclosion de la COVID dans les provinces en question, évidemment, on voit une augmentation qui est quand même alarmante en Colombie-Britannique, au Québec aussi. C'est d'avoir des réactions qui sont sur mesure quant aux demandes des communautés autochtones elles-mêmes. Et donc, ce ne sont pas des... D'abord, pour répondre à votre question très clairement, ce sont des sommes nouvelles dédiées sur mesure pour répondre aux demandes des communautés aujourd'hui au Saskatchewan et en Alberta, tout comme nous l'avons fait la semaine dernière avec le Manitoba. Et donc, ça fait partie de notre plan de déploiement de sommes prenant acte évidemment des éclosions qui sont... comme je l'ai dit en entrée, en introduction, 4 fois plus forte que les chiffres que l'on voyait durant la première vague. Et donc, nous sommes toujours prêts pour répondre de façon stratégique et directe pour aider les communautés dans les autres provinces qui sûrement vont être affectées.
Est-ce que vous avez une question de suivi, Marie-Laure?
Oui, en fait, c'est pas sur le même sujet. En fait, c'est par rapport au décès de Madame Echaquan. Ça va faire presque 2 mois. On n'a pas de nouvelles de l'autopsie. On n'a pas de nouvelles du coroner. Donc, on voudrait savoir qu'est-ce qui se passe parce que c'est anormalement long.
Je trouve ça très long aussi. Je n'ai pas la réponse pour vous. Je suis impatient de voir les détails de ce rapport comme vous. Vous êtes sans doute au courant du fait que la communauté a ratifié le principe de Joyce cette semaine. C'est quelque chose que nous révisons, que nous appuyons, évidemment, pour voir comment ça pourrait s'appliquer à l'entièreté du Canada, à l'entièreté des provinces au Canada et des territoires. C'est un début. Nous continuons évidemment de travailler avec la communauté et la famille de Joyce pour assurer qu'ils ont ces appuis durant cette période prolongée de deuil.
Merci, thank you. Nous allons maintenant prendre les questions de la salle. Encore une fois, une question et une question de suivi. We will now take questions from the room. Once again, one question and one follow-up.
Good afternoon, Olivia Stefanovich, CBC News. Minister Miller, you had to rectify a situation yesterday involving your Ontario Regional Director General with respect to Niskandiga and the terms of reference of the investigation into contractors and as well as the third-party investigator who was chosen for this investigation. Why did this happen, and are you and your Ontario Regional Director General on the same page?
Well, thanks, Olivia, for highlighting that. During, I think, 2 days ago, we all had a call with Chief Muniz and then Grand Chief Alvin Fiddler to go over really the step plan of where we need to get the community in a place where it's ready to repatriate. The worry that we have is about safety of the community first and foremost, safety of the water. And we walked through a number of the issues. And one of the issues that came up during that was the investigation into some of the contractors that have built a number of the plants or are contributing to build a number of the plants in the area. We had a fluid discussion about the terms of reference. What was clear from that discussion was this is something that we wanted to do in partnership with Chief Muniz, not only with respect to his community and what perhaps has gone wrong or not been right in the past, yes, to assess what happened, but also that we don't want this reproducing in other communities, and neither do they, to their credit. I mean, they're focused on an unacceptable condition that's lasted a quarter of a century, but they're also worried about their brother and sister communities. And so we had a fluid discussion about the terms of reference, and I undertook to the chief that they would be intimately involved in any process of elaborating the terms of reference for the investigation. The job that Anscon occupies is perhaps one of the most difficult in Indigenous Services Canada, and she does great work. But what she reflected to the chief was not the reflection of the conversation. So it was right in that case to send my regrets to the chief that this was not something that should have been sent. And I wanted to clarify that personally to him, which I did. What we agreed to on the phone call 2 days prior still stands. So we'll be working with him in terms of elaborating the terms of reference of the investigation as it is enlarged as well to other communities. And critical to that is having their input. Again, with respect to understanding. What I understand, I haven't reviewed all the emails. I may do that when I have a few minutes, but I understand that one of the auditing firm that was proposed that does do investigations is one that they had when they were under third party. So I could understand how that's offensive to them, but we'll take their guidance obviously on these things. So we're working really, we're working against the clock, a community that doesn't want to be in Thunder Bay but has to be through no fault of their own. To make sure that they have the conditions to move back safely foremost, and particularly given COVID, and we're there to help with them. But again, the email that was sent didn't reflect the agreement that was made, and so in working with my deputy minister, we quickly reversed that.
Has this ever or that you've had to walk back what the Ontario Regional Director General has done?
Personally, under me as the minister, to my recollection, this is the first time.
Thank you. Next question. Prochaine question.
Good afternoon, Minister Miller. Kevin Gallagher, CTV National News. This question is from my colleague Omar Sachedina in Toronto. So you told CTV News this week the federal government is working on booking out the Victoria Inn in Thunder Bay to reduce the risk of COVID exposure for the evacuees from Neskantaga. How's that process going? Have these rooms been booked? What's the cost? Fill us in.
I don't know what the cost is, but we're going to do it. We just, when I was interviewed, I just didn't have confirmation that was being done, and I told the chief that we would work on it. And so it was literally 3 hours after I'd undertaken to the chief to work on it, and I was in that comfort zone that we were going to actually get there. But I believe, the best of my knowledge, that we're there, and we're gonna book it out. The cost is the cost. We want to keep these people safe, and they're worried about the outbreak that's happened in Thunder Bay. They had a contractor in their community, and this is perhaps an example of some of the challenges we're facing with water and COVID. They had a contractor in Neskantaga that tested positive, and that causes an immense amount of anguish and apprehension. And so too with when they're seeing license plates in the garage with Manitoba on it, and knowing the growth of COVID that we're seeing in Manitoba, obviously that's going to cause some anxiety with the community that's already under an unacceptable amount of stress. So we did so gladly. It's just I couldn't confirm at the time, but I think I can confirm now that it's done. Yeah.
Yes?
Yep.
Okay. Indigenous Services Canada says testing on the new water treatment plant will be complete by December 2nd, but representatives from the First Nation have doubts. So I don't know if you can answer this, but I think they want to know when they can go home. And is that December 2nd deadline for the water treatment plant still firmed? Once that's good, can they go home, sort of?
Well, my hopes is that you will know as soon as we know. As I told the chief, I'm not asking him to trust me, because that trust is so thin, and what he wants to see is action. And part of that is ensuring that they have proper representation with the folks that are doing some of the testing, proper representation in and around the opening of the plant. That new plant was brought online a couple days ago. There's a process that needs to be followed in order to flush the systems, flush the distribution systems, and then there's a 14-day period of testing where the results have to come back in an acceptable fashion. And given the legitimate challenges they've had with their system, their old system for 25 years, that skepticism is very understandable. So there's some trust building to be done here. It starts with having full disclosure with respect to the tests, comfort that 14-day period is being properly respected, and then at that time the decision that will be taken to the community to go home. So I don't impose those timelines on them. They are worked out with us in cooperation, and when they're ready to go home, we want to make sure that they're getting home safely. But I think, to the best of my knowledge, that actual 14-day clock started ticking either today or a day ago. So you can work out the math. But then there's a discussion in that time with the chief as to when the proper way is to get back into the community.
Merci. Prochaine question, next question.
Good afternoon, Jordan Press with the Canadian Press. Minister, I wanted to ask you about, because you mentioned issues with data and trying to get good numbers. Can you talk about some of the challenges that you have in getting good data, what you're doing to try to overcome them, and particularly when it comes to maybe the interaction of off-reserve Indigenous peoples and how that works into some of the numbers you're trying to get?
This is going to be an exceedingly long answer, because this is something that we look at the numbers every day, and we look at the challenges that are presented with respect to them. First and foremost, it starts at the questions you're asked when you're being tested, whether you're Indigenous or the series and cascade of questions that you're asked. These are all administered by different provincial bodies. And so where we sit in Ottawa, there's a long challenge in collating all this data, getting it together, having it assembled in the proper way, and then being able to take proper public health decisions based on this. And the proper public health decisions are with the starting points that Indigenous peoples, given their vulnerabilities, are 4 times more susceptible to COVID and to be impacted by it in various ways. This is borne out, for example, in what we are seeing with our neighbors to the south and Indigenous populations. When you look at the Alaska numbers, they're 5 times higher. When we look at the 5 times higher than the already higher numbers in the U.S. In the rest of the U.S., it's about 3.5 times to 4 times higher. If you look at some of the exceedingly alarming numbers in the Navajo Nation, where there have been thousands and thousands and thousands of cases, thousands of deaths, these prove out what we've already said with their vulnerabilities within Indigenous communities. That allows us to tailor our responses. So that's the importance of data overall. What we've seen throughout the first wave is lower numbers. And when we talk about those lower numbers, it's very important to emphasize that we're not doing so to pat anyone on the back, but to talk to Indigenous communities about the work that's been done and the work that has actually worked through their leadership to keep them safe. And so when we look at the second wave, we look at trends, and the trend that we've seen is exceedingly alarming, still lower than the national Canadian rate, but it's growing, and there's no magic to keeping COVID out. It goes through the basic health protocols, the testing, tracking, and isolation that is so key to keeping people safe. But those vulnerabilities still exist, and where we see those vulnerabilities exemplified most is, for example, in urban areas like in Winnipeg, where we see the numbers of hospitalizations and the numbers of people in intensive care disproportionately being Indigenous. It tracks a bit what we saw from H1N1. We're perhaps doing a better job, but this is something on a totally different scale. Now, when we talk about data, Indigenous Services Canada tracks what we have sort of effective jurisdiction over, which is the on-reserve reality. We know the numbers we're getting from the nursing stations. We know the numbers we're getting from testing. We work with the provincial governments, but that's when it gets a little trickier. There are nuances to that when it comes to territories, when it comes to First Nations Health Authority, which is really first in class. And some of the great work that's been done in Manitoba to collating all those numbers with the Secretariat that they've done in a pretty good fashion to get a really global sense of the numbers. For that, it takes a lot of work. So when I say we have an imperfect picture of Indigenous infection across Canada, that's reality. And it's a reality that we struggle with because it's very hard to tailor those options in order to keep people safe. The federal government has a role to play with respect to Indigenous health off reserve. It's clear, but it places an effective challenge, and that effective challenge is made more so when we don't have proper numbers. So it's a process of working with the governments. It's a process of working with First Nations. We funded, for example, Janet Smiley to do some work on that, who's really on the front lines in Toronto, and a number of other organizations. But to say that we are relatively comfortable with the numbers, well, I think it would be it wouldn't reflect my current state of mind, as you can tell. But it is an ongoing challenge to get those numbers because we can't have the tailored responses that have helped Indigenous people stay safe to date, and then afterwards tailor good public health policy without a complete picture. We know those trends, but it's really there's some art, but there's some science behind it, and we want to get more science than art.
I guess what is the timeline then to get for all those different strings you just talked about? What is the timeline to tie them all together so that tailored response is as effective as possible and you're not missing out on pockets that you really should be tailoring a response to?
Well, it's an ongoing challenge, frankly, and I don't have that timeline. I know that we're working quite aggressively to get as much data in as quickly as possible, and I think Val can speak to it because she lives it, and Tom. But it's a process of working with local authorities, with provinces. Some are better than others. There's no point naming them. They're all doing their best to move and react, but where the rubber hits the road, for example, is when we have to deploy vaccines and identifying where those vulnerabilities are. There are places where the federal government can play a role, and there's a place where we'll have to work with the provinces to make sure that those that are most vulnerable will be properly served. And when it comes to Indigenous peoples, we still have a struggle getting them the best health care in a country that prides itself on its health care, and that is an ongoing challenge that will surpass COVID. I think Val might want to speak to that.
The only thing I'll add is that, the provinces, the Health Canada, Statistics Canada, the Public Health Agency Canada has been working with provinces and territories to improve the overall quality of the data that is coming back through the Safe Restart agreements with respect to COVID, and reporting with respect to Indigenous status is actually part of those requirements. And so Dr. Wong, myself, Dr. Wong more than I, have been engaged in sort of the bilateral discussions with provinces and territories around what is the current state of the data, what can be done to improve the quality. There has been some improvement and some progress over the last couple of months, which has been quite encouraging. But understandably so, some provinces want to ensure that they have a partnership agreement with First Nations, Inuit, Métis partners, and that they have a protocol that is negotiated with them also about, the sharing of that information, its analysis, its interpretation. Some of those protocols already exist, like in Manitoba, in Ontario. British Columbia, for example, but they've not necessarily been established in all jurisdictions, which has caused a bit of a delay. But I think that it is a priority for everyone, and I think the opportunity that COVID has offered in that regard is to actually finally address some of the challenges with respect to Indigenous health data in a distinctions-based way with provinces and territories.
And on that note, as Valerie has, just talked about, in meetings with provinces and territories and First Nations health authorities and other health authorities, we are bringing together, all the players who need to be at the table to discuss how each province or each territory can support each First Nation, Métis, or Inuit entities in order to collect data, analyze data, and use the data. And we are seeing progress at this point. When we actually look at, for example, BC's First Nations Health Authority, able to analyze the data and able to actually talk to First Nations about the data. Likewise, Manitoba. And they post it on the website, so you can see the data every day publicly. In addition to that, Chiefs of Ontario as well. We're supporting Chiefs of Ontario in order to build the capacity in order to do those analysis. Likewise, we're working with FNIGC, or the First Nations Information Governance Center, in order to help build the capacity so that they can do it across the country. Likewise, we're working with ITK Inuit partners in order to actually do that. And it's really important that we have province, territory, and Indigenous partners and us all at the table, working together with Public Health Agency of Canada. So,
Thank you. Merci. C'est ce qui fait fin à la conférence de presse. This is what ends today's press conference. Have a great day.